Welcome back. This is number 2 in a series on the pandemic, and we're going to talk with Danial Hultin, who had COVID-19, and he's going to tell us all about that. Stay tuned. Welcome back to another FUTRtech video podcast. Today, we're going to take a little detour into the coronavirus itself. We've been hearing a lot about people who have been infected, and the stories are all over the place. So today, we thought we would get a firsthand story from someone who survived COVID-19. So let me tell you a little bit about Danial Hultin. He's a young, fit guy who is incredibly hardworking. He has a real blue-collar work ethic, and I have seen him work through the flu, pneumonia, bad back injuries, everything. But coronavirus took him out. He was down for the count for more than a week. He got it, and he got it bad. Fortunately, he did not end up in the hospital on a respirator, but it was a little bit touch and go for a while. Danial, so glad you're doing better. Thanks for joining us and sharing your story. Appreciate it.
Oh, thanks for having me, guys. And I'm definitely looking forward to sharing kind of my experiences, both good and bad, and what we can learn from it. And hopefully people can take what's happened to me and realize that this really is real. And even in mild cases, it can be pretty bad for you.
Yeah, I'm sure. And as usual, I have Sundish Patel with me. Say hello, Sundish.
Hey, everybody. Thank you so much. Danial, I just want to say thanks, man. I know when we reached out to you, this wasn't exactly a very comfortable ask because I wanted to be respectful of how you're feeling and how you're doing. And I know you got young kids at home. So I just want to say thank you so much for doing this. I think it's really important what you're doing. It's probably out of your comfort zone, but I really appreciate it. Thank you.
All right. So Danial, you had, I know you have a very enlightened perspective about this sort of thing. I know you were very cautious and doing the right things, but you still got it. Could you just walk us through sort of the timeline of what happened to you? If you could.
Yeah. At the beginning of this pandemic, we took all the precautions we thought were necessary. Going to the grocery store, wearing a mask, using gloves. Granted, I had to take a couple extra trips for my own parents because of their own immune systems themselves. Coming home, we're taking, groceries out of the bags. We had a system on the counter for one side with the groceries that we just brought in. And then on the right side is everything we took out. We disinfect them when we could. We were washing fruits and veggies in vinegar, taking cereal out of the boxes, throwing the boxes away, doing everything we thought was necessary to avoid this. And ultimately, it still happened. And it's mind-boggling.
So you think you got this from the grocery store, if I understand?
I don't think I could have gotten it from anywhere else. We were following every precaution necessary. We weren't going out to any, Dunkin' here or, any drive-through. We were just going to the grocery store when we absolutely had to and came home. And how do you avoid that? I mean, you have to eat.
Yeah. What was the first inclination that something was going wrong there?
Oh, well, at the beginning of, the March, April timeframe, you're thinking pollen or pandemic at that point. You don't know if it's your allergies or if it's actually the coronavirus. And it started with, kind of a dry cough. And, you don't think anything of it because it's the beginning of spring. So, things are in bloom, things are going to bother your throat. And it kind of accelerated relatively quickly over a couple days time frame where it went from a small dry cough to a very painful dry cough to fever. And then I'm talking at the time to my boss going, I'm actually scared because I woke up and now I'm overheating. I can barely breathe already. I'm getting ready to call my doctor, do teleconference and things like that. And it just, over this couple days, it just went from, okay, I think this is manageable to I think I have this and I'm pretty scared.
So it was like just a couple days. You got it. You started feeling sick, and it was just over 2 days that it sort of really rapidly accelerated. Huh?
Yeah, and to me that means that it was in my body for a few days time, potentially up to 2 weeks. We don't know for sure. The concern is, did my wife get it? Did my kids get it? Did I spread it to anywhere? And that kind of runs through your head. And then that kind of leaves when you start coughing and hurting and just overheating and the breathing, and realistically the body aches. And it was just a couple days. It went from okay to I'm in bed and I'm not responding to people right now, and I just need to isolate and hopefully, keep this from getting to the rest of my household.
Oh man. So tell us a little bit about so after those first couple days and you started getting feverish. I mean, I've heard that it's really hard to think when you've got this. I mean, people talk about this sort of fog that they're in.
Well, yeah. I mean, when you kind of go from a clear thought process to, okay, I'm just trying to essentially survive at this point, because your mind kind of just drifts away and all you're thinking of right now is my body hurts. I'm not hungry. I can't smell. I can't taste. My joints feel like it just ran 100 miles, and you're just constantly sweating. And then the worst part about it is you run out of breath when you're trying to take a couple steps. I'm trying to just go to the bathroom and I'm already running out of breath, and it's scary. And as you mentioned in the beginning, I've had the flu, I've had pneumonia, I've had a lot of things, and me being stubborn, I always worked through it. This one just took me down. It was a haymaker.
Wow. So how long did you have, this sort of really heavy period of this? And were you just I think I got to go to the hospital, or were you I'm afraid to go to the hospital? And tell me about that. How did it go?
Right. So, it's scary because you think that, first, am I going to go to the hospital or not? And then you're worried that you might have to go, because what happens when you go there if it just gets progressively worse. If you're put on a ventilator, you really think that, am I even going to get out of this? So right. You're fighting like heck just to make sure that you can breathe enough to at least stay home and isolate and not have to go to the hospital, because if you're there, to me, it feels almost like a death sentence. I know that's not the case, but that's the fear, because now I've gotten a virus, a disease that is incurable right now.
Right.
And there's nothing I can do about it. And I hope that I have the genetic makeup to pull through. And I had a great support system, between work and home that really helped me kind of pull through.
Yeah, it's not only uncurable, but it's to some extent untreatable. There's a couple sort of subtle treatments like remdesivir and potentially hydrochloroquine, but it's really not treatable even. There's not a good therapy for this.
No, and you're right. You're pretty much left to your own devices. They'll throw everything they can at you, from a CPAP to an inhaler and everything in between. And there was a 3 to 4 day stretch where I'm laying in bed and I'm gasping for breath, just laying there and wondering am I gonna actually pull through this? And knowing that my wife's on the other side of the door, and she can't even open it up to look at me because, she's a type 1 diabetic, so she has issues of her own to deal with. And for her to be able to heal from this, we can't risk that. And she can't even really look at me, and she's scared. And I'm scared, and my kids don't understand what's going on, and they just can't see their daddy. And that, it hits home so much, especially when your daughter's, tucking notes under your door just to let you know that they care. And you try not to cry about it, but it's good to know that they're thinking of me, and you guys were thinking of me, and everybody was thinking of me when I was going through this, because it was something that my stubborn butt couldn't even work through.
Yeah. So tell me about, you obviously reached out to a doctor, what was the doctor's advice here?
The worst thing that you can think of with a doctor is he tells you, okay, you have this. Unfortunately, right now, we don't even have the testing capacity to send you there. And unless you're coming from a nursing home and you're an elderly right now, you're on your own. And if it gets to the point where you need to be hospitalized, then we may test you at that point. But then you don't know if they even have a ventilator if it gets to that point either. And it's just like one roadblock after another. So, it's bad when a doctor you get pre-screened by a nurse to have a teleconference with a doctor to say, I'm sorry, we can't really do much. And we wish you the best.
Wow. That is not what you want to hear from your doctor. No, you're on your own. That is not something you want to hear from your doctor when you're feeling really, really sick, man. That's got to freak you out.
Man, it's scared the living daylights out of me. It scared my wife, and you try to keep a chipper mood just for your children's sake at that point, but all they hear is all the bad stuff on top of it. Yeah. And I know they can see the worry in my wife's face, and she's a saint. They were great bringing food to the top of the stairs, walking back down the stairs so then I could then open up the door and attempt to eat something because, marrying an Italian wife, she's making sure I eat no matter what. And I can't thank her enough for that. She went well above and beyond. I mean, the adjustments they made from moving my son into my daughter's room, making sure that, she had a place to sleep. So she was sleeping in his bed. They were sharing a bed together. Everything was rearranged just to make sure that I can get through this and they don't get it. So realistically, I isolated in our room for about 12 days out of the 14 days that we kind of figured it once we backtracked a couple of days with the doctor. He's like, if this is when your cough started, usually this is about ballpark where we can figure out where you had it. And even then, we still took the extra precaution to wait an extra day or so. It's like, what? I've been up here this long. I'm not the best looking Rapunzel, but I'll wait in the tower a little longer.
Well, I know you too. And I got to imagine, as sick as you were feeling, you were probably, it was more sickening to you to think about, your family getting it. I mean, that's, I couldn't imagine, I have this terrible illness, I give it to my family, and then, something bad happens there. That's just, just horrible.
As bad as it was, I'm glad it was me more than my wife, my children, or my parents. I know that, when I get hit pretty hard, but I can always get up off the mat and keep going. I was pretty darn healthy going into it. I'll get back on the horse eventually. But, I was, as weird as it sounds, I was glad that I was the one that got it out of everybody in my family and my friends, for sure.
So did you have blood oxygen sensors and things like that? I mean,
so we did have a little oxygen sensor that I was using on a daily basis until I realized it was just making my anxiety a lot worse. But I had to use it just to get a ballpark figure of where I was at. And, my doctor said, he's like, if it gets into the 90 to 93 range, you have to, if for a prolonged period of time, you're going to have to go in. And there was a few days I'd wake up, it was 89, 90, and I know it because I felt it. It was like somebody sitting in my chest, but then I would focus for hours on breathing just so I can make sure my breath is there, because the last thing I wanted to do was hop in an ambulance and go.
Yeah. So what medicine? So what medicine are you taking at this point?
So right now I'm taking, I take nothing right now. The only thing that I was using at the time, because they gave me the Z-Pack, because pneumonia is always a concern with COVID as well.
Getting a secondary infection.
Yeah, and towards the middle of that, I took that as a precaution. There was no way I was going to roll the dice on that. And on top of that, they gave me the inhaler. And the inhaler I would use just in case, essentially when I get to the point where I couldn't breathe anymore, that would just kind of open it up just enough where I could essentially probably not panic. I don't know.
Were you getting like a claustrophobic feeling from that? I mean,
it's just, when you're taking the deepest breath possible and it just isn't enough. And I can't stress that. I had a mild case of this. This was a mild case, and this is what I was struggling with. And the breathing scared me. The joints on fire, like every joint, like my knees, my shoulders, elbows, walking on my feet itself. It just, everything would hurt. And I have never felt anything like this in my life.
Wow.
And that's the part I would,
So then how do you sleep?
Grasp.
So how do you sleep?
there was a few nights there wasn't a lot of sleep, and because I was scared of potential pneumonia and things like that, which have been in the past, I was sitting upright. So lower back didn't feel very great, but I'll take that as I'll take that any day of the week. So there's a couple days of maybe sleeping 2 to 3 hours a night if I was lucky.
So there's multiple days that you're in pain and there's really nothing you can do about it, and that's multiple days.
Yeah, because
that's a mild case.
Exactly. This is a mild case, and that's scary.
Did you try laying on your stomach? I know that's one of the things that they try to do because it takes some of the pressure off, so you can breathe a little bit better.
I did not try that. I would have probably tried anything. So if I'd have known about that, I would have shoved pillows under there and laid on my stomach all day.
Oh man. So tell me a little bit about so you don't want your family to get this, right? So what did you do to isolate from family? You said you stayed in a room and everybody sort of relocated and you just kept the door closed. Did you do any other isolation practices?
So I had my mask and gloves up here in case, I had to even open up the door. So anytime I opened up the door, I wore gloves and a mask. But I never left these four walls in this room.
That's the room you were in.
This is the room I was in. This is ground zero here.
Wow.
But
what's even more shocking to me is the fact that the precautions that you guys took as a family are way more than I would think 90% of the average family has taken, right? And yet you still got it. Yeah, you know what I mean? Because we didn't do any of that at all.
We've been doing that. We've been cautious around our house. I mean, we've been really sheltering in place. We've been, they say the groceries you don't need to clean.
Fruit. He's wiping his fruit. He's taking his grocery. He's taking his cereal. That's what
we've been wiping our groceries down too. I mean, over here. So.
Yeah, I mean, no, we have been too. Is that what I said? No, we've been totally doing that.
Totally doing that.
Yep.
Well, but I mean, the new guidance is that does they're saying there's no known transmission from groceries to people.
Really?
But who knows? I mean, who knows?
Who knows?
I mean, we're not testing effectively. We're not. I don't even know if you never got a test. So do you show up in the statistics?
No, then that's the thing. Anybody that's at home, and there are thousands and thousands of people like me that are at home that go through this, and they're not a statistic. They're not counted. There are people that are at home that are actually dying from this disease. They're not counted. So these numbers that you see, these are just confirmed cases that they've been able to swab for. And there's plenty of people that they have it and they will never be able to be tested. And our only hope is that, they go through the antibody test, see it, that they already had it, that confirms it. And hopefully they can donate blood and help the cause at that point in time, because that's essentially all we can do. But there's so many people that are not counted, and it's actually kind of scary if you think about it.
Well, have you sorry, you mentioned sort of the plasma, donation is a thing, have you been approached about donating blood and plasma for?
Yes. So that's something I've talked with the wife about as well, and she's definitely on board with me doing that, because I mean, literally, that's all I can do at this point is donate blood, and I'd be happy to do that. Take as much as can, as long as I can walk out. We'll and I hope it leads to some type of answers for somebody somewhere.
Yeah,
Daniel,
that's crazy.
What's one thing that you see on TV or you read about after you coming through this whole thing? What is the one thing that kind of pisses you off or just kind of annoys you a little bit?
Big pet peeve is the one I hear the most is it's like the flu, and I can't stress enough how much that irritates the absolute heck out of me. It is so far gone from the flu. It is so much worse than the flu. And at least in my experience, and most of the people I've talked to that have contracted it, that weren't tested either, they're like, this is not the flu. This is something much worse. And to the flu's credit, there are vaccinations. There, you can get your flu shot every year. You can't with this. I can't stress enough to anybody out there that thinks that this might be a flu of any sort. It really isn't. And I beg you don't roll the dice on it, because it doesn't feel good. And if it comes up snake eyes, the loss for you is your life. That's not worth it for anybody.
The last time you and I were talking, you said that, and we say this in our world, in our society, is I don't wish this upon my worst enemy. And you said that very, very specifically, like and I know some of your enemies, and you even went too far to even point them out and say, how much I hate blah blah blah. Even that person, I would not want them to have it. Which really, first of all, it's very human and very awesome of you to say that. But it just tells me like how terrible.
Yeah. I mean, there's times I can be petty. I can be pretty angry, borderline vindictive. But I would never. I just can't wish this on anybody. I really can't.
It's crazy.
There isn't somebody I dislike that much.
Yeah. No, I mean, it's terrible. I mean, the deaths are. I mean, we have now officially passed the death toll of like the Vietnam War. There's about 250,000 dead worldwide right now. We've exceeded the combat casualties of World War I with this. So the combat casualties are 53,402, and we're 61,000, 62,000 now dead. Yeah. In the U.S. alone.
Oh no, it's almost up to 70. It's like 68,000 something.
I'm looking at it right now, and it's confirmed 58,505. So, but I've heard other stats that it's between 58 and 61. But and they're now they've raised the estimated totals to over 100,000, which is equivalent to the Great Plague of London, which was about 100,000 casualties.
And it's mind-boggling, because they want to make sure that, they want to open up the economy. And I understand that, because people have lost their jobs. 30 million people applying for unemployment over a 4-week period. That's incredibly insane. And to feel the frustration from them is absolutely valid. They have every right to to raise their voice and talk to people and let us know, but they have no right to spread it to anybody else. It's like, you know what, if you want to protest it, that's fine. If you think you need to contract it, that's fine. But if you're going to contract it and then bring it home and potentially give it to your own family members, the elderly, anybody else, I mean, the
healthcare system, you're going to be an impact on the healthcare system. I mean, that's the biggest problem. And it's sort of a selfishness that is just I don't understand. But I'll tell you something. We did a podcast with Mark Janus, who's a travel agent, and it's a family business, and he's basically losing everything he's worked for his entire life in that business. So I do feel very sympathetic to the people who are losing everything. And there's people who, especially the people who are more vulnerable, who've been impacted by this more significantly too. It's horrible on every side, and there's just no solution. But I feel like the problem is if we don't do the right things, it's just going to make it longer. I mean, the fact that we didn't have early testing caused us to have to shelter in place because we, couldn't contain it. So now we're there. I mean, it's like every piece that we don't do along the way and don't do it in a timely fashion ultimately extends the run of this, right? And that's what's scary to me.
But I also feel like the more Daniel stories there are, when it hits your family, it hits your friend, it hits your colleague, it hits your neighbor, it hits those people. To me, it's like cancer. When cancer hit my family, that's when I truly, really appreciated it, right? When Daniel told us his story, right, Chris, the first time he said it, you and I were like quiet.
Wow.
Because like we just couldn't say anything, right? I was like, holy shit. Like if this really, truly is what's happening, people need to know this, because how many people really know like this is the impact?
Yeah. Well, I mean, we lost somebody in our family, and it was in Detroit, so she didn't get she had a ventilator briefly, and then when she tested positive, they took it away from her, and she took her several days to die in hospice. So I mean, we've personally been impacted. I mean, I'm hearing stories from all sorts of people now, of relatives who have died, and it's.
And by the way, to that point, Daniel, so like when we're so I sent Chris a video on this. It was on CNN. somebody actually said, I think it was Dr. Bricks or someone, like, they're very proud to report that there's been no deaths due to the inability to actually get a ventilator. So I took that and I sent it to Chris because his aunt, Julie's aunt, is an example of that situation, but yet we see that on TV. So, like, how good is the data that we see on TV? Right?
Not very good.
Yeah.
Yeah. As you see, I mean, the data is the data, and they're just massaging it however they see fit at this point. And it's like the virus doesn't have an agenda. It doesn't care who you're affiliated with. It doesn't care who you vote for. It doesn't care what you believe in. It's just going to come for you whether you like it or not. And the best thing we can do is do our best as a community, as a country. And, to your point, we have to contain it at this point because the fire has already started. We couldn't prevent the fire. All we can do is try and contain it. And when social distancing actually works, you question it because you're like, why are we doing this? Well, it's because it's working. When it doesn't work, then you're going to be wondering, well, why are my friends dropping instead of when can I go out and get a haircut?
So Daniel, tell me a little bit about how you're feeling now, right? Is there like any leftover symptoms, things that are going on?
Yeah. So, with any sickness like that, you're a little weak when you come out of it. What's been a little surprising to me over the last, couple of weeks right now is still getting my breath and getting my capacity back. I wasn't like an avid runner, but you guys know I lifted a little bit. I would run, as necessary. Usually towards an ice cream truck, but I was still running.
Dude, so you're the only guy I know that has worked out twice a day. That's crazy.
And it was a nice endorphin kick. But now, I'm walking around the block and I'm finding myself still trying to catch my breath after a little bit. I can't really walk really fast right now. I can't go at a nice brisk pace. And it makes me think, like, is it going to come back? Am I going to get this back all the way? I don't know this right now. And I keep working through it and all I can do is hope for the best, but there's some residual, after effects that are still there. And, I don't know if that'll ever come back, to be honest with you.
Did your doctor have an opinion about that? I mean, because, that's sort of the thing I wonder about. Like, what are because nobody knows what the long-term implications of this are, right?
And that's exactly what my doctor said. Again, I love him because he's honest.
And you hate him because he's honest too, probably.
Exactly. I'll take it though. And he's like, we really don't know. He's like, there's a chance you're not going to get that back. We don't know. And there's so many unknowns with that. I know that I'm not nearly as strong as I was, and it's going to take some time to get that back. I've never been taken down like that. I got beat up pretty good.
Yeah. Well, it's funny. So I was reading an article. The Washington Post reported that in New York and Wuhan, between 14 and 30% of ICU patients had lost kidney function, requiring dialysis.
Oh my.
And in New York, hospitals were treating so much kidney failure, they needed more personnel who could perform dialysis. And they were running short on supplies for dialysis and treating the kidney thing. But the other thing that was really bizarre was they're reporting a lot of young and middle-aged people who were like just barely sick with COVID-19 were dying from strokes. And I saw this one doctor talking about how he was called in to treat a stroke in a young patient who was COVID positive. And as he was removing the blockage, a new blockage was forming around it.
I read
and
that.
So like there's all sorts of aspects to this that are just we don't know. And it seems like there's just a lot of other stuff going on here that's crazy. Yeah.
And it feels like we're being reactionary, but we can't seem to be reactionary in the right way right now. It just feels like we're just playing catch up every time we turn the corner and we think we're starting to make some inroads. It's like it accelerates a little further. And that should scare everybody.
Well, and that's why I think it's, you keep saying the people that drive you nuts are the ones who say it's just the flu. And I think the thing is like, these are people who barely got it. They were relatively asymptomatic, right, but they were having significant damage to internal organs, outside of this. Right. So it's a little frightening. I mean, even people who think they're not going to get it bad, you know, you don't know what the long-term implications of that
Chris,
are, right?
who's the guy on CNN? Chris Cuomo?
Chris Cuomo.
He was saying when he got it that he was having hallucinations. Yeah,
hallucinations.
Isn't that what he was saying? He was saying there's some kind of like brain effect where he felt like he was getting dizzy and he felt like he didn't really know where he was.
Well, apparently, you know, it passes the blood-brain barrier, which is sort of unusual. Yeah. Perhaps in someday in the future, it'll be useful for medical treatments, but I guess it can cause inflammation in the brain that can cause, you know, really.
Daniel, did you have any of that? Did you have any kind of like brain type impacts?
So the confusion, no, the dizziness and stuff that was there. You know, that's most of those check boxes I would tick for that. But that hallucination portion, I'm probably lucky I didn't experience that. Which is fine. You know, it's probably a testament to my wife probably shoving more fluids and food down me than I could potentially even want to see.
Good.
Yeah. So. I'm glad I didn't get that one. I'll pass on that. Thank you very much.
Yeah. So Daniel, did you experience the loss of smell and taste like so many people have reported?
Absolutely. Yeah. The smell portion kind of went pretty quick without all the congestion. You know, it just disappears, and then the taste followed shortly after, which, you know, kind of coincided with, I don't want to eat anything. I don't want to, you know, nothing. And she could have probably fed me a leather shoe and I wouldn't have known any different at that point in time. I had nothing. It was
and
incredible.
Has that come back?
Oh yeah, it has now. I get to very much enjoy food, pizza, you name it.
Oh, that's good.
You know, so that'd be pretty depressing, I'll tell you that.
Yeah. No, I'm sure you want to be able to taste your whiskey at some point, right?
Absolutely, that is most important.
Tell me a little bit about like what do you want people to know? Like what's your big message? You got an audience here, so what do you want to tell people?
Oh man, no pressure. No, so. What I'd like to tell people is it's very real. It's very serious. And you're not just doing it for yourself. You're doing it for everybody around you. You know, you're doing it for, you should respect your community, your people, everybody that makes up this nation, this country. Everybody cares. Everybody wants to see this country succeed. They want to see whatever company they work for succeed, their family. They want to see all of that. They want to see a happy, healthy family unit. And to wear a mask and to go out in public and wear a mask might be an annoyance right now and things like that. But it's not just for you. It's for other people around you. You know, there's a statistic. It's like 17 to 19% of people are asymptomatic. So they're just carriers. So, you know, that you could be protecting other people. All it takes is one person to walk by somebody that works in an old folks home and that place is decimated. This is beyond serious. And please don't make it political. Don't make it anything but about the well-being of everybody from to your left, to your right, front, back, center, everything that's around you and people that you don't see. Just care is what I can't stress that enough.
Amen, brother.
Yeah. Well, I'm sure this is giving you a very different perspective. And I'll tell you, I spent the weekend, you know, like I got my little sweatshop down here in the basement. I found this new filters and, you know, for making the masks. I made 6 masks on Saturday. So I 3D printed masks that are more like respirators, like these, but they weren't as popular with the family. They like the more procedure style masks. So we're going that route.
Understood.
We'll be out there in masks.
My daughter's got she's got a Sono with a kitty cat face on it, and then my son's got the puppy dog. It's like you got to make the best of the situation. So and they're excited to wear them. So you know, you're like,
new
okay,
fashion
you're excited
accessory.
to go out in a pandemic. So let's.
Well, I gotta tell you, that's been one of the good things. Is like at least my kids, they don't really completely understand it, and I think that's a good thing. Daniel, our kids are all the same age. Well, your daughter's a little bit older, Chris, but I'm kind of glad that all they see is the fun part. Because if they actually really, truly 100% understood what's actually happening, I think they'd be depressed with mommy and daddy, right? Right now, mommy and daddy are just trying to keep it all together and pretend like everything is amazing, you know? But
yeah.
You know.
Yeah. Well, Daniel, I really, really appreciate you coming on here and sharing your story and, like helping to fight the good fight here. It's super eye-opening to hear, a direct story like yours. And I hopefully people get the message because, I'd like to get to the other side of this quickly.
Yeah, and thanks for having me, guys. And just to end it, thanks to all the first responders, all the nurses, all the doctors, everybody that's on the front lines, all the essential workers, everybody that's had to work through this. They had no choice. Thanks to all of them because this has been pretty rough. And the best we can do is say thank you and try and support them any way we can.
Yeah, and they've been disproportionately impacted by this, just from a health perspective as well. So yeah,
absolutely.
I mean that is sort of the the new heroes, the new brave heroes, for our nation. So
absolutely,
I think it's a good message. Yeah. So thank you, appreciate it. If you like what you saw here, please click like, hit subscribe, and if you want to get notifications when we post new content, click that bell icon. And I will see you in the next video.